Hello, everyone. Welcome back to the Martin Sibley Show podcast, Purple Changemakers. And really excited today. We've got a very interesting crossover around healthcare in a sort of broader sense of topic or vertical or focus with technology around apps and AI. And obviously, implicit in that is social entrepreneurship and change making and all the topics that I love to learn about and chat about. So, welcome, Michael and Shyam from Advoca. We've had some really great chats the last couple of months in person and online, and I've been supporting you guys as a bit of an advisory role as well. So, as we've said a few times, this is for us to kind of encapsulate our rich conversations for others to learn more about you both and the app and the need and yeah, wherever it takes us really. So, first of all, thanks for joining me on the show,
Thanks so
Mhm.
much for having
Thanks
us.
for having us. And let's get stuck in. I mean, I always like the backstory, really. Like, it'd be good to know a bit about you both, kind of maybe how you met each other, as much as obviously what led to the app. So I'll throw it out, and whoever wants to go first, just dive in.
Amazing. So I guess I can tell a bit of the story, can't I, Sharon?
Yeah.
You can correct me as we go along. But Sharon and I, we met back in 2022. So we just graduated from medical school and we'd been placed to do our foundation training up in the northeast of England. So we were living in Newcastle, and we actually were working in the same NHS trust. We were both working in South Tyneside, Sunderland. Unfortunately, we weren't in the same hospital. Well, I was in Sunderland, Sham was in South Tyneside.
Yeah.
And that was a really, really special time for us, of course. Like, I feel like for any doctor, graduating and being able to work clinically with patients is a really kind of transformative period of time for like you as an individual and like as a professional. You're suddenly doing loads and loads of work with lots and lots of responsibility. And, the way that training kind of works is you're cast to any part of the country straight out
Yeah.
of medical school. So it's really funny how you end up with a group of people. Um, you know, every doctor goes through this. So you end up with a group of people who've all been through that same thing and end up in one strange place. But yeah, Sham and I met, we had some mutual friends, and we both had a shared interest in technology. So that's how we hit things off.
Yeah, to elaborate on that, when I first met Michael, he was telling me about how he was working like 50% as a foundation doctor training and 50% in health tech, um, kind of working for a company called Sync VR, which made like VR medical software for patients. And I remember thinking like, oh my God, you can do that? I didn't realize that this was an option. And yeah, like as soon as like talking to Michael, I have always been a bit of a techie and like nerdy person. I thought, you know what, this is like what I want to do as well. Um, I don't just want to work clinically in a hospital, but I want to help people at scale as well, building software and making advances in health tech. So yeah, it was a Titanic meeting.
It was, it was. I remember there was a really funny period of time. I think we had our advanced life support training, didn't we? And we were in the we were doing our training in a hotel in South Shields, uh, South Tyneside rather, around there. South Shields, it was somewhere near near the hospital. And I've been telling Sham about my work with Sync VR, and I was like, okay, I'm going to bring my VR headset in, so that you can see it. And I brought this headset in my bag just to show Sham on this training day. Put the headset on Sham, and Sham is just stuck in this in this virtual world, like doing all sorts of tasks
I was like
that
playing this game and like because the speakers were so loud and I couldn't see anything, I was kind of like sensorily deprived. I must have been like shouting at the top of my voice and like playing this game in the middle of this room filled with doctors all like doing their like life support course. And like the person running it was like, "All right, can you please stop doing that, so we can move on with the lesson?" I was like, "Oh yeah, okay." We still passed. We still passed. It was fine.
yeah,
Of
still
course.
passing.
I love
But
that.
yeah,
Yeah, it's lovely to hear the broader kind of backstory of how you both met. Obviously, the medical training side of things that you both did. And I think when you sort of spoke about helping people at scale, when we talk about entrepreneurs and startups or technology, like the whole point of all those things generally are to impact lives positively. And when you look at entrepreneurship and startup businesses that have scaled, you go back to, how like Uber is an app that fundamentally touches a lot of lives to help us get from A to B more easily. But I think, what a very positive field to apply entrepreneurship and technology, where it's at the absolute forefront of helping people's lives be better through health. Because as we've also talked a lot about, I've got SMA and there's challenges of the sort of accessibility in the world, but there's also the considerations around managing health and well-being with a condition such as SMA, and there can be such a cognitive load trying to like look after yourself and figure out what the impacts of having something like SMA is over time. And you've got social care funding, and then obviously to your field that there's different touch points with different healthcare practitioners. And so yeah, I just wanted to make that point that we can get lost in labels of entrepreneurship or technology, but like it's always about helping people and making people's lives better, and applying it to healthcare is like a double thumbs up in my opinion. So I really love that. Can you, I guess, sort of bring us further on that journey now? Like you've met, and I love the image of you playing around with the headsets and everything. So how did you go from that to what Advoca is, in terms of, I guess, sort of seeing there was a problem or a need, as well as having an interest in what technology may or may not solve it?
Mm. So, from my perspective, I continued working part time in the NHS for for 2 years total, whilst working at SyncVR commercially. Um, and then I found an opportunity to move into artificial intelligence and to go into the field of ambient voice technology, which is the technology that we use at Advoca, which we can talk about in more detail in a second. Um, so it was at that point that I left the NHS and went full time into digital health, um, using AI to automate the writing of medical notes for doctors. Um, and it just so happened that at the same time, Sham was working for a different digital health startup, as a software developer. I won't speak too much for you, Sham. But things lined up quite well shortly after that, didn't it?
Yeah, yeah. So just to elaborate a bit more on like my path, um, after my first year of training, I decided to, I wanted to build things. I wanted to make an impact at scale. I wanted to get my tech skills up. So I started learning software engineering properly. I learned how to program properly, and I worked for a health tech startup as an AI engineer for a little bit. And obviously AI is in everyone's minds at the time, and I was like, right, I need to understand how to build like proper, reliable systems with this that can be used in healthcare. And so that's why I kind of went down that route and got that experience. Um, and I think both of us we talked a lot about starting our own venture, but like had no concrete ideas. And I guess last year I was thinking a lot about how when you're working clinically, when you're in the hospital, you see so many problems with the infrastructure, so many problems with the way things are done, and you could be like, oh, I can think of a solution to all of these things. But the difficulty in fixing a lot of problems in hospital is that you need to go through the pathways. It takes years. You need to be compliant and adhere to regulation, and there's a lot of additional kind of steps required before your solution can actually start making an impact on people on the wards and in clinics. And I thought, what's the best way to make the biggest impacts in healthcare the fastest is to build something for use by patients completely under their control that we can give straight to them, and just empower patients directly. rather than going through a healthcare provider or a hospital or something like that. So Michael was talking about this ambient voice technology. There's a lot of technology out there that doctors are using to record and use AI to make their notes and make their lives easier. And I thought, why is there not anything like this for patients? And we can build it, and people can just start using it straight away. And for me, and Michael, like, that's the most satisfying thing to be able to work on is something where you can immediately just see the results, and immediately start getting feedback and go lightning fast.
Yeah. No, thank you for sharing that. Michael, do you want to add anything?
Yeah, I think it's I'd like to kind of focus on making impacts at scale, because a question that Shan and I get a lot, being, of course, medical doctors who aren't working in the traditional sense within the NHS in that clinical capacity, we get asked all the time, kind of, oh, what's it like now you left medicine? But to be honest with you, since working at Advoca, it doesn't really feel like that's something that's happened, because as Sham's mentioned, we've made a tool specifically for patients, which is essentially infinitely scalable to whoever needs it. And we're solving a real clinical problem for patients. So really, it's like we're still practicing medicine by delivering a product
Yeah.
through developing a product and making it available to people when they need it in terms of their healthcare. It's, it feels very, very similar, and we're still getting, using all of our background and expertise, applying it in a different way, thinking outside the box. It's yeah, I guess
100%.
it's been super, super fulfilling to take the focus away from a procurement pathway, for example, for to improve a very specific administrative process in a hospital, which of course is an important process that can be streamlined. From taking the focus away from that and all the headaches that brings, but now going directly to patients with a tool which is going to make them better at understanding their care, better at involving their immediate family and support network to be able to make better informed decisions about their health moving forward. It's a really, really powerful mission that we're on. And I guess we can get into what it is that we're actually doing and why we're doing it.
Yeah, exactly. Yeah, I mean, I think that, if you've read any kind of book around change making and startups and activism, and it often is that the threads of the people, the backstory, how it came together is really the storytelling, what people love, and then obviously, of course, like Business 101, it's like product and features and benefits and product market fit and marketing, which I know you've been head into that because that matters, and that's part of being able to have that impact at scale. You have to do all those businessy things as well. But yeah, like it's lovely just seeing how both your paths converged and have come together with this idea. And I think, I was even thinking when I look at the activism side that I've been involved with disability, often we've always looked to like how to influence political or legislative change. And it's possible, but it's a hard, long fought process. And there was almost a parallel or a similarity with what you're saying, that of course in the long run tools like this should be procured and used in the vastness of something like the NHS, but you don't just drop it in a month and off you go. And so instead of trying to win that battle early on, you sort of pick your battles, and by doing it direct to patient, it's still within all of the legalities and regulatory part, obviously, which I'm sure you'll reiterate and reassure throughout. I know you do generally very on top of that stuff, but yeah, you can get that reach and impact much quicker and easier, and learn and iterate and improve. So there still is a point down the road it could become almost like an enterprise tool for larger organizations. But as we know in startup world, it's easier to do it as you are. So just to kind of reflect back that thinking and those views. Did you want to add something, Michael, there?
Yeah, I think this like aligns really well with kind of a mantra that I have, which is especially relevant to us now at Advocate. But I think just generally in terms of starting starting a technology business, I think there's a lot of merit to putting a lot of focus into kind of the lowest common denominator in the market, so to speak. And I guess the lowest common denominator in our market is the patient. And, if you can do a huge amount of volume of outreach to the lowest common denominator, and, you accept this is going to be a lot of work to do, and you just keep going, just keep going, just keep
Can
going.
you just, for listeners, explain when you say lowest common denominator, what you mean by that?
Yeah, so I mean, maybe I've just made up the entire term, Martin. So thanks for asking me to
No,
to
I do know
explain
what you
it.
mean, but it'd just be good to like lay it out in a different term for some people as
Yeah, of
well.
course. So when I say the term lowest common denominator in our sense, I mean, I guess getting right down to an individual level
Yeah,
and reaching individual people, in our case, individual patients, and presenting them with our solution
yeah,
and our product. And I think that taking those steps intentionally
yeah,
early on is so, so valuable if you want to make kind of a higher level, let's say, for the sake of argument, political enterprise level change. I
yeah,
think beginning to slowly change the tide from at an individual level is really, really valuable, and something that I think every founder really has to kind of go through
yeah, agree.
is, especially in the consumer business, is just
Yeah,
go and talk to everyone
yeah,
and
Mhm.
accept that if you do it enough, then things will start changing in your favor. It's
yeah, yeah. No,
that's really kind of really valuable point, and I think that's the exact way that we're going about this.
yeah, we'll come back a little bit later, essentially to the kind of people finding out about the marketing. Really, we'll touch on that a little bit later in our chat because I know you've been doing some very interesting things in how you're getting in front of the right kind of people that the app benefits. Kind of as you just said, that one by one approach rather than procured from one person for thousands straight from the offset. But yeah, let's just kind of bring it back to, so for those maybe still like a bit of clarity of okay, what is the app and what's the benefit of the app. And I think particularly for, I mean, obviously, partly when we spoke, we have leaned into that I have a medical condition called spinal muscular atrophy. So that I'm sort of thinking for this now bit, it's like someone like me or a different kind of medical consideration. What's the app and what are the benefits of me downloading it?
I guess we can start with the clinical problem, can't we, Sham?
Yeah.
And go up from there. So, well, I mean, this is something that Sham and I saw working clinically. It's something that doctors see a lot. It's something that patients notice a lot, and it's something that's observed widely in research too. And it's essentially that patients forget a huge amount of what they discuss with clinicians in their clinical appointments. That's kind of the anchor of this whole thing. There's
Mhm.
some research from the early 2000s that shows that up to 80% of what is discussed with clinicians is forgotten immediately by patients as soon as
Yeah.
they leave that consultation room.
I know
So,
that feeling for sure. Yeah.
yeah, exactly. It's staggering, and people don't really think about it very much. But the kind of the other element to that research that was done, that of the remaining percentage that is remembered, it's remembered inaccurately by the patients.
Hmm.
So what you have is a situation where people are going to appointments and really they're taking very little concrete information away with them, because there's simply there's not like a printout immediately as they leave. This is everything that was discussed, everything that you said, everything that the doctor said, for you to go and read as soon as you get home. That doesn't exist, and it hasn't ever existed. And that's exactly where Advoca comes in. So Advoca is a tool which is used by patients. It's in the form of a mobile app, and it lets patients simply record their appointments, their health appointments, and what they get at the end is that quote unquote printout. They get a summary in app of everything that's been discussed with the clinician, everything that they've said, everything the clinician said, all the any results that have been mentioned, the next steps, the plan. That is something that is now possible and available in Advoca. So
Yeah.
um, yeah, that's what we've
Hmm.
developed.
Yeah. We know
And
that
that's
whenever
this is
you
what.
try and, write almost try and note take in any context, you struggle to then be present in the conversation, right? So you're either like trying to jot everything down to the detriment of then being in the chat and thinking of questions you want to ask, or you're present in the conversation and you're asking whatever questions feel correct and appropriate to ask the doctor or the consultant. But then, as you say, you forgot their answer by the time you got out of the room.
Mm.
So it's kind of on both sides of that is the benefit there. And the recording is audio. Just I'm sort of clarifying that for listeners. It's not like a video recording, but it's an audio recording that then AI transcribes and then gives the outputs that Michael just mentioned. And Shyam, do you want to elaborate or move forward on
Yeah,
how that's evolved?
sure. I mean, you mentioned, it's difficult to stay present during appointments when you're trying to take notes or think of questions. And I think one of our main goals with Advoca is really to help patients be present and informed and confident during their appointments. And a new feature that we're pushing out soon is you can schedule any upcoming appointments you have, write down any notes, any questions you might want to discuss, any topics. And then when you start recording the appointment, it will pop up with all of your pre-written notes as well. So you know exactly what you know how to take advantage of the appointment to the max, to your maximum benefit, really, and make the most of that interaction. And at the moment, we want people to start using it and building up this personal health record by recording their appointments, even uploading old appointments or telephone appointments if they have them. But very soon we envision Advocate being a complete personal health assistant. So not just being able to record appointments, but soon you'll be able to scan any clinical letters you have, any test results, any documents like that, and have that added to your record. And we'll also have a chatbot feature as well, similar to ChatGPT, but instead grounded in the knowledge of your personal health record, in the knowledge of official and verified patient resources from online, so it can give you trusted and reliable personalized healthcare information.
And on behalf of the listener, viewer, the sort of safety side is you're very big on that. I mean, I'm not
Yeah.
making any, I don't know as to ChatGPT's exact policies, and I think we all know that whole world is evolving, but I think it's a great moment to share that obviously the transcriptions and the data are kept securely and not shared, right?
Yeah, to give a quick run through of our security, so we're fully GDPR compliant. You have complete control over your data. You can edit it, delete it, request a copy of it, whatever you'd like. And if you do consent to share any data with us, it's all very explicit and explained in full detail for you. And all of our secure servers are secure. We're based in the UK at the moment, so all your data is stored in the UK. And things like recordings and so on are just stored on your phone, and we'll never have access to the direct recordings, or we'll never save them.
Cool. Thank you for that. And I know when I've spoken to people about what you guys are doing, what Advoca is, a couple of times people have sort of said, what about the NHS app? Which I kind of, knowing you both and Advoca a bit more because we've spoke, but I imagine that's going to be a question people are curious about. So yeah, what's the what's the benefit of the Advoca app as opposed to the general login into your NHS Notes app?
So the NHS Notes app allows you to do a lot of things. It allows you to like book appointments and check your prescriptions and things like that, and very useful and obviously essential to a lot of people's care in this country. Advocate doesn't encroach on that kind of space. Obviously, you can access your GP notes through the NHS app. It's not completely reliable, but you can
Yeah, I can
access it.
attest to that
And
one. Yeah.
yeah, I think the advantage that Advoca has is your health in your words. So when you record your appointment, that is exactly what was discussed, and it has all the detail. Whereas the GP's notes are going to be shorthand. They're in a rush. They're written for themselves as a GP. There might not be an explainable language.
They've been note taking while in the conversation with you, right?
Yeah,
It's
yeah.
what they remember. Yeah.
Or even if they're using one of these new AI technologies, it will be written in doctor language.
Yeah.
Um, and also mixed in with a bunch of other things which might be more noise rather than signals when it comes to your health. And Advoca just helps distill everything down, keep it simple, and have the full record of your health there. And obviously, we would like to integrate. There's not just the NHS app. There's other like Health Connect apps as well, where people I know get their test results from clinics and letters and things like that. And so obviously, we want to make things as easy as possible, and integrating with the NHS app, and pulling that data in, and then adding our kind of AI intelligence layer on top of that, and making it explainable. I think that would be really amazing. And it's definitely something that's on our radar.
Cool, thank you for that. So yeah, I mean, I think that's pretty clear. Like, there's obviously a few different ways we can go. There's a lot of ways we can go, and I am mindful of the time as well. But ultimately, there obviously are certain, let's say, types of disabilities or medical conditions that you're aware that may have more value or benefit as you evolve. I think there's clearly benefit to anyone that has medical appointments, but I know that there's sort of early adoption of certain use cases. So I want to give you a chance just to share for a minute a bit about the types of conditions, for example, which are sort of then kind of connects into the same point we said earlier of the marketing and like how people are finding out about it, how you're putting it out there, and how it's going. Like, what you sort of maybe share when you launched, and just that kind of how it's been going up to date would be a good sort of snapshot for people as well.
Yeah, of course. So, if we think about why we've made Advoca in the first place, it's because people forget a lot about what they've discussed in their appointments, and secondly, they also don't understand what's coming up for their care, essentially. And that problem is worse in the context of certain conditions. So, Sham and I have been prioritizing getting Advoca out to people with rare conditions and also what we call serious conditions. It's kind of a really broad umbrella term, but it includes um, essentially complex chronic illness and also cancer. So that kind of group of patients who have frequent appointments to manage those conditions, that's exactly where we're aiming Advoca to be used initially, because we know that's where the greatest need is. Um, the the nature of having conditions like the ones that I've just mentioned is there's frequently quite a lot of emotional overwhelm. There's also that medical complexity, which means that inherently there's just a higher barrier to ordinary people who are trying to go about their lives and manage their health, just understanding baseline what's going on, what all the new terminology means, and things like that. So that's how we're offering Advoca initially. And the way that we've been doing that is very simply partnering with charities that represent those groups of patients to incorporate Advoca into some of the support that they offer. And we're also going through social media and reaching people directly who we know fall into these categories and simply offering them Advoca. And if they like it, share with us some feedback. And if you like it enough, then please talk about it with your communities. That's the way that we've been going about it at the moment.
And to clarify, again, that we know it, but others might not. It's free, right? Free to download,
Yeah,
free to use. Yeah,
Completely free. Yeah.
yeah, yeah.
yeah.
I mean, I think that's she bouncing between the specifics of what the app is and how it benefits people. And there'll be some people watching and listening to this that can be in that group of benefiting from the app. But then, yeah, that broader change making side as well of, in the modern world, the way you're using AI tools and the way you're using social media is, to me, very interesting and very exciting that, a business, even particularly in healthcare, even health tech, 20 years ago would have looked very different to how you're going about it. I just think that's quite an interesting point to draw out of this beyond the use case and the benefit of the app, but that broader, like you say, using social media to literally one-on-one tell people about it, and then also they can become almost advocates of Advoca
Mhm.
in that
Everyone.
community sense as well, which I just think that's fascinating. I don't know if you want to build on that or move on to any other things to touch on, but that to me is like really cool with what you're up to at the moment.
I mean, I think it's such a special time to be founding a consumer business because it's never been easier to reach so many people who are going
Yeah,
to use your product. And it's also never been easier to kind of get those people. I mean, this is the ultimate goal, isn't it, with any business, is that they love it so much that they tell all their friends about it.
yeah.
That's the ultimate goal. And it really, I feel like it hasn't been easier to, or at least more straightforward and obvious way you need to go
Mhm.
to be able to enact that kind of change. Um, if you're thinking back 20 years or so, trying to think how you would actually,
Yeah.
replicate this kind of
It's
work.
wild, isn't it? Like
Yeah.
I mean, I 20 years ago was probably graduating, give or take, starting in the world of work, and it doesn't seem that long ago for me of like when I was starting out my career. But yeah, the tools at our disposal is ridiculously good, and yeah, and something that we've touched on and I've been very clear and almost bullish on is I think your future steps will get to this point is that when you know the more tighter cohorts of groups that are really getting that benefit out of Advoca, that there's we social media used to be build up follower numbers and you hope that a percentage of your followers see your content. It was more like an email list where you're like
Mm.
growing followers, where you grow subscribers, but it's become because of TikTok more like interest media, like an interest graph. And so one bit of content that is clear from the first second with the title and the bit of the copy, like who it's for and what the value. The value can be humor and entertainment as much as sort of specific things around healthcare and tech and products. Like, but the value is picked up by the algorithm really clearly. And so with very few followers, videos can go viral is a bit of a not bad word, but like a misleading word. But relative to the baseline of organic reach, something can
Mhm.
just pop with minimum follower numbers. And we see this more and more at Purple Goat with all the work we do there with influencers and brands. I just wanted to articulate that observation I've had. And I think that's what you're doing the one-to-one bit, and then people start to even create a bit of content as well about it, like that evolves into and grows into, as you say, that people are helping spread the word for you, and in the long run, that will have a tipping point as well.
Precisely.
Yeah,
Yeah, it's really interesting, specifically with TikTok. Again, first time ever that you've been able to just throw something out there, some kind of content or video,
yeah,
and there's a chance, a very real chance,
yeah,
that you're going to be able to get reach that you would never be able to do without that as a platform.
Yeah.
yeah, yeah. And I think for people anyone that's sort of thinking of it for their projects or businesses, change making, it's not to be dejected if every video for quite a while doesn't go massive viral. There is a thing about consistency as well, and over days, weeks, months, it will all grow like nice and steady. So, but your point is true that one could just pop, and that's exciting. But the opposite side is not to feel dejected or like a failure if it hasn't popped, because yeah, even the way you're using with the one-to-one interactions is like extremely useful and powerful for you moving Advoca forward. So just sort of drawing us towards a close, is there anything we haven't covered that you still really keen that we say? Is there anything particular you had in your mind to add to what we've already spoke about?
I think it'd be good to kind of talk about the long-term vision for Advoca and kind of the
That
wider
feels
good
like
that
a
we'll be able
natural
to.
close, doesn't it? Yeah.
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 So so some of the wider good that we're able to do with the product. So um yeah, so the kind of information that we're getting into Advoca is really, it's one of a kind and it hasn't ever really been collected before. And what I mean by that is things like real clinical transcripts, um, I mean people's interaction with health related chatbots, for lots of different reasons. the questions that people are asking after their appointments, the resources that people are accessing. And one option that we put forward to every sign up, every new user of Advoca, which is completely up to them, it's completely an opt-in process, is that users can contribute those inputs to be anonymized and further analyzed to basically generate a better understanding of health as a whole across our user base. And this is really, really important. Something that Sham and I are really, really passionate about is being able to help instrument good change in terms of research, to help get new treatments developed and brought to market. That's exactly the kind of further change that we want to be able to enact, and as well help ordinary patient advocacy groups to better understand their populations and be better able to advocate for the needs of their families. There's lots and lots of benefit that can come from people using Advoca, and contributing to that process.
Yeah, well, when
I think,
you referenced earlier about that larger sort of macro opportunity, when I said it political, legislative, or lobbying, it was specific around like procurement within something like the NHS for technology. But what you're also saying is like it becomes the sort of data insight part that these advocacy groups and charities that you're partnering with, giving them more ammunition to then lobby on all sorts of things as you've just articulated. So it's again that longer term, larger impact, but only made possible by this kind of ground up community swell
Yeah.
of using the app. Yeah.
yeah, exactly. And I think to add on to that, obviously there's a lot of healthcare data out there, and a lot of healthcare data being collected and analyzed. I think something that's really exciting about what Advoca is gathering is on the holistic side of having a condition, of having a disease. As we move more and more towards a kind of holistic view of medicine, generally, evidence on like the lived impact of diseases, on the burden of that disease on your day-to-day life, on your carer's life, things like that, is so sparse, and I don't really understand why, but with the kind of data that Advoca is gathering, that's exactly what's going to be the most impactful, I think. Like helping provide the evidence to push forward new treatments and say, like, look, this set of conditions, or this treatment or what have you is like significantly improving the quality of life of all these people and the people around them. And those are the kind of insights we really want to unlock.
Yeah, that's great. I don't know. I think what I've shared very honestly with you both over my life, but because there's never been an imminent cure or big treatment for my condition, there has had to be and continues to be a need for like how to live as great a life as possible within the context of having the challenges that something like SMA provides. I think to your point, like it can definitely help down the road, possibly cures for things and certainly more treatments. And I think without it flipping off into other verticals, there is definitely that sort of like proof of the need for the inputs as well. And forgive me if it goes slightly out of your core focus, but we did talk about, where there is social care assessments, it could be down the road that it's a tool that help people in that way. So it's the medical
Definitely.
holistic health, but there's also like the living, the burden of the bureaucracy of just
Yeah.
dealing with wheelchair funding and social care. And I, sort of not saying that's where you are now and there's not an imminent plan, but we did agree that this could become a much broader tool, in these types of directions down the road as well. And I guess I'm also thinking of my disabled activist friends that it's the barriers of society have to be overcome as much as the sort of like how we manage disease and the health part of it. So I just wanted to speak to that macro view of living with a disability. But yeah, it's very exciting what the data and the insights can provide obviously you as Advoca, but your partners in a number of different use cases, is my point.
Hmm. Definitely, definitely.
Okay. So yeah, I think we'll kind of draw to a close. I felt like we've covered what I hoped we would. As it was not ever so long ago we actually first messaged and then met at the famous Golden Lion in St
Mm.
Ives. Um, and I've really thoroughly enjoyed our chats, and I already can see how much progress you're both making in that relatively small bit of time. So I think, if anyone watching has got further questions, probably a good point actually. Can you let people know where to get the app if they want to play around with the app, but also if they've got, whether it's sort of questions of getting the most out of it themselves and or ways of supporting spread the message. There'll be a few people listening and watching that might be able to support you in those ways as well.
Of course, yeah. So the best place to get people to visit is advocahealth.com, and that's our website. And there's links there to the App Store and the Google Play Store to be able to download Advoca directly for iOS and Android. And there's also contact details there for you to be able to reach out to us. And we're always checking our inbox to look for people who want to help us move this journey along. So you can find all the information you need there to reach out and also make use of the app.
Cool. Thank you for that, Michael. And Shyam, any closing remarks, final thoughts you want to share?
No, not really. Yeah, thanks for having us. It was really great. Very happy with everything we talked about. I don't think there's anything I feel we didn't cover. Also, for those listening, Advoca is spelled Advoca.
Nice. I was thinking
Yes.
whether to do that as well. That's a good shout to spell it. I will pop the link on the show notes, as they say on the podcast. So
Hmm.
yeah, that I'll cover it with a link. But that's great to spell it for people. And yeah, just yeah, as I said before, I love what you're doing. Really excited for you both, for the app and all the impact that it's having and will continue to have. So thanks again for continuing to make all the positive changes in the world.
Thanks so much, Martin, and thanks for
So
having
much
us.
fun. Thank you.